Mastering hand expression involves a certain knowledge about your own breasts. So you've got fatty tissue around your milk ducts, and obviously we are trying to get milk from those milk ducts to express out colostrum or breast milk. If you are to express too lightly, you're not going to be accessing those milk ducts. And if you are expressing too firmly, you can cause some damage and some bruising, which we really don't want. So to start off with, it's really good to have a shower first. Having that hot stimulation on your breasts really help get things flowing. When you get out of the shower, you're going to do a fairly light massage where you can go around the breasts in a kneading motion or using the palm of your hand. Just a couple of minutes. You could just start on one side first, and then after you've expressed on that side, you can move to the opposite breast. With the shape of your hand, you do need to have your hand quite far back. So about 3 to 4 centimeters on either side of your areola in a C shape. If you were to go too close, you're not going to be accessing the milk ducts that can go all the way up, right close to your armpit. So when you have your hand in a C shape, you need to push your hand back to put some pressure onto those milk ducts. We don't want your fingers sliding back. They need to stay in the same position. Press back into the breastbone, and then you're going to squeeze forward until you get right up to the nipple. If you don't see anything straight away, that's completely normal. Just try again. Again, don't see anything, you go again. Usually you'll start to see a few little drops if you're expressing before you have your baby. Now, to collect that milk, if you're quite handy with a syringe, or if you've got a support person helping you, then they can just draw that milk drops up. If that is too tricky, you can just have a medicine cup or a shot glass even, and as you get to that point, moving forward, you're just going to collect those drips. This can be really difficult if you've only got tiny little drops. That's what we expect if you're expressing antenatally. But again, the more you express, the more drops you should start to see. Now, as it starts to die down and you think, there's not much left, we're going to move your hand around the breast. So you can go a little bit this way to access these ducts and these ducts, and then into a U shape to access the ducts on either side. And again, you've got your about 3 centimeters either side of the areola. Push back into the breastbone and then move forward. And then you're going to collect the drops. There is no specific time frame. If you are stressing out, then you need to stop, because those cortisol levels will decrease the beautiful oxytocin we need you producing when you are expressing. Try and do it while you're relaxed, listening to some music, or once you get the hang of things, you could even be watching TV while you're doing it. When it comes time to storing your breast milk, if you have used a little cup, you still want to grab the milk through the syringe. Now, if it's your first baby, you start off with a 1 ml syringe. We don't expect you to get much at all. If you are getting 0.2 or 0.3 of a ml, that's amazing. It will work wonders for your baby if you need to use it. If you wanted to express in 2 sessions throughout the day, so maybe you're getting really excited, you're on maternity leave and you've decided, right, I'm going to do a morning session and an afternoon session. You can keep the expressed breast milk at room temperature for 4 hours, However, if it is quite warm in your house, we always recommend storing it in the fridge. So say you've collected that, you're then going to pop your little cap on there that you've been given again by a healthcare provider, pop it in the fridge. The next time you might want to express in a cup, you need to put them both in the fridge so that they both go to the same temperature. Once they're both cold, you can then get that syringe that you used earlier that day and draw it up. Again, put your cap on. You're going to label it. So if you have sticky labels, you can ask to get those from your healthcare provider, or you can just make some up yourself where you are just writing on your name, date of birth, and the time that you expressed, and then pop them in the freezer. Obviously, if you're only expressing once a day, pop the label on there straight away and put it straight in the freezer with the cap on. It's a good idea to keep it in a container or a little Ziploc bag so that it's still kept nice and clean. It's not sterile once you open it, but we still want it to be kept clean. When it comes time to transporting your colostrum to your hospital or wherever you decide to birth your baby, then put a little note on your hospital bag so that if you're in labour, your partner can remember to grab it from the freezer for you. You're going to need to put an ice brick underneath your expressed syringes and then an ice brick on top so that it stays really cold, and then keep them in either a esky or a cooler bag. When you get to hospital, you want to give it straight away to your midwife so that they can pop it in their freezer and keep it frozen. If you forget to take it to the hospital, it does last in the freezer for 3 months. And a lot of people swear by keeping it for their little bubba. If they ever get sick in those 3 months, you've got the most amazing antibodies in this colostrum that you can give to your baby.